in terms of the matters that are national on the UHC and the Global Fund people, that the Council of Governors together with the Ministry of Health fast track or rather come up with the framework to engage Treasury to provide funds for purpose of putting them or rather transitioning them to permanent and pensionable term, because we allege that we have been raising the issue that they are being discriminated and the terms that they are working in is discriminative in nature and they are being paid peanuts. So therefore, on that two issue and also the CBA, we had the issue with the Council of Governors where they had directed that we negotiate with the respective counties, despite the previous agreement that we had on the return to work last year. They had directed that we go and negotiate with the respective counties. In our resolution, one of the resolution we made on 14th was clear that the Council of Governors was to establish a team that will negotiate on behalf of the 47 county to realize a CBA for the clinical officer within 21 days. So today, why we call you here is to communicate that the first item on the Social Health Authority has been fully resolved, because now all the facilities that had been excluded have been included in the Social Health Authority system, and that has been ongoing. Today, I know they are still working on the professionals whom have not also all of them been included. And also, they have included or rather interlinked the system by the Clinical Officers Council to ensure that whichever is happening at the Clinical Officers Council, it can be able to be interlinked with the digital superhighway system, that now they are able to facilitate everyone without who is qualifying today to continue practicing.
While others are suspending strikes, doctors at Moi Teaching and Referral Hospital in Eldoret are set to down their tools in 2 weeks' time unless their concerns stemming from unresolved collective bargaining agreement or CBA's issues are addressed. Kenya Medical Practitioners, Pharmacists and Dentists Union, or KMPDU Secretary General Davji Atela, condemned the hospital's failure to honor the 2017 and 2021 CBAs. He listed several grievances, including the hospital's failure to convert contractual terms into permanent and pensionable employment for doctors.
I've raised concern in our meeting yesterday, where they're saying that in the month of November, December, and part of January, even the oxygen plant was not working. There was no oxygen in the hospitals. Doctors have raised concerns that they do not have drugs in these hospitals, that they are forced to actually supervise death of patients, yet this is a national referral hospital. When you bring these issues to management, they are claiming that there's budget cuts, that the ministry has reduced the budget with 2 billion. It is not our business whether budget cuts are there. Our concern is that, is it possible to get quality of care for the patients, and is it possible for doctors to be supported to do the job? And therefore we are saying, even if the budget is reduced to zero for Moi Teaching and Referral Hospital, we want the issues that are pertaining to the welfare of doctors resolved. We want that the hospital should be there to serve the doctors, and should be there to serve the patients as expected.
You know, when some of these CBAs are entered into and not, are not honored, I know at times it's because of money, but at least if people can talk before it results in people going to the streets, it can really help, because every time there's a strike within the health sector, quite a number of people lose their lives as a result. I was watching very, very unfortunate incident where a young man was bitten by a snake. I'll try and remember which region it was. He was I think it was Kilifi. He was bitten by a snake. And what happened, he's taken to the hospital, and because the doctors are on strike, nothing was done to him. And you're talking about a young man of around maybe 12, 13 years old, brought by the mother, and he passed on as the doctors looked on. And I thought, What kind of human beings would do that? Even if it's because of money, somebody has come bitten by a snake, and this is where time really matters. Your Hippocratic oath does not allow you to just watch on as this person loses his life like this. It was very unfortunate, and I wish actually, action can be taken on the medical staff who were there. That's murder. For me, as far as I'm concerned, that's murder. You could have done something you never did, you just watched. And the Bible says, do not be deceived. God is not mocked. Whatsoever man soweth, that shall he reap. Wiper leader Kalonzo Musyoka now says the cabinet in place is not broad-based, but blood-based executive, founded on the wrong and unconstitutional principles. Musyoka said this during a press statement and said that the government has been implementing unconstitutional policies like the housing levy, which he termed as an abomination. The former vice president further pointed an accusing finger to Kenya Kwanza government of sponsoring state capture, overseeing a failed education funding model and health insurance.
This is the essence of democracy. I repeat, as I've done before, that taking over the leadership of this country, executive order number 1, do away with housing levy, taxes.
Yes.
They are unconstitutional. They are almost an abomination. You don't take public land, give it to your friends. You're selling steel and cement to them. You've even taken over Baburi cement under conditions that are questionable. The model was clear. So the children of the poor, they're being asked to look for millions. Well, not millions, a lot of money. To them, they are millions. It amounts to millions. Yeah. A lot of Kenyan students cannot access university education. Mtoto akimaliza grade 9, driver nikamuuliza anaenda wapi? Ajui. They get MCS from Tanzania. We know what you are doing. And if you don't believe in the spirit of gangsterism, listen to this. 5 million shillings kwa meza. You sign impeachment, anatembea, collect 2 million. Ukimaliza kazi, the 3 million utachukua. Is that the type of democratic leadership we expect? And the paymasters are known. I think we will expose them as we go on. Simply because you cannot take criticism.
Kalonzo Musyoka. I don't know, I wish, but it's something that probably he'll build over time. I don't know whether he has the time to build it. What he's saying is true and it's right, but unfortunately doesn't have the kind of force that Raila Odinga has. At a time like this, we need a very strong opposition to push the government to do what is right. But he's trying. Anyway, elsewhere, there was a rallying call made by the head of state, William Ruto, and his deputy, Kithure Kindiki, for a united country devoid of tribal politics. The leaders urged Kenyans to remain firm and not be torn apart along divisive lines. Ruto has hit out at the impeached deputy President Rigathi Gachagua, accusing him of attempting to divide Kenyans along ethnic lines, adding that his efforts will not bear fruit.
Na vile vile nimekuja hapa kwa sababu ya mambo ya title deeds. Nimepatia nyinyi title deeds ya mashamba yenu, title deeds 1000 niko nayo, nataka niwapatie. Ndio kila mtu asonge mbele, tuweze kusonga mbele kama taifa. Vile vile kuna mashule pale nilisema tutajenga kama serikali, naenda kuanzisha ujenzi wa hizo mahospitali mashule leo. Vile vile niliwaambia mambo ya stima, si ndio? Nilisema hii stima isiwe starehe ya matajiri, iwe ni haki ya kila Mkenya. Sasa nyinyi watu wa Busia tumewapatia shilingi bilioni 1 na milioni 50. Tuunganishe watu 17,000 wapya kwa huduma ya stima. Na hiyo kazi mimi nakuja kuanzisha kesho. Ndio mastima izunguke hapa. Hawa viongozi wetu wote waheshimiwa wabunge wanajua kila constituency tumepatia pesa yao. Kila constituency tumepatia contractors wao. Ndio nyinyi kama wananchi muweze kufikishiwa stima, ndio tuweze kuondoa koroboi, tuweze kuhakikisha kwamba kila mtu anaishi mahali ambapo inafaa mwananchi wa Kenya kuishi. Tunaelewana? Hiyo kazi mimi narudia hapa Busia kesho. Vile vile mimi niliwaambia ya kwamba mambo ya manyumba, mambo ya markets, kuna markets ambazo tunajenga hapa Busia. Markets mpya 5. Na nitarudi hapa kwanza Friday, mimi nitakuwa hapa Bumala. Kwa sababu tunajenga soko kubwa sana pale Bumala ya karibu milioni 300 na kitu nakuja kuanzisha. Na alafu nitarudi hapa hii masoko yenu kidogo kidogo hii, taongea na huyu governor ndio tuweze kupangana vizuri.
You know, the head of state was very busy yesterday. In fact, he also mobilized Kenyans to register for the Social Health Authority, saying it will benefit citizens and will reduce harambes for clearing medical bills. This comes on the back of numerous complaints and dissenting voices over the health plan, with Kenyans saying it's not working.
Ili nchi yetu iendelee haraka, lazima tuwe kitu kimoja kama taifa. Kusiwe na ubaguzi wa kikabila, wa kidini, wa kijinsia, wa kiumri, kusiwe na...
Mimi nataka niwaambie vile vile, katika hiyo mpango, mimi nilisimama hapa Luanda kwa market hii. Na mimi niliwaambia ile maneno ya matibabu, ile ilikuwa inaendelea chini ya NHIF, ambayo ilisemekana lazima uwe na kazi ama uwe na uwezo ndio uweze kupata bima ya afya. Nikawaambia hiyo tutabadilisha, kwa sababu hakuna Mkenya anachagua kuwa mgonjwa. Ni kweli ama si kweli? Kwani mimi nauliza nyinyi watu wa Luanda, mtu mwenye ako na kazi na uwezo ndio anakuwa mgonjwa peke yake? Si kila mtu anakuwa mgonjwa. Kuna mtu anaandika application akuwe mgonjwa. Ndio nimesema hii mfumo mpya ya afya, hatutaki tena Mkenya aende hospitali ati anauza mali yake ama anauza ng'ombe yake ati kwenda kulipa bili ya hospitali. Sasa tumesema tuko na bima ambayo wewe mwananchi kazi yako ni kujisajili. Ule uko na uwezo utaambiwa utalipa kiasi gani. Ule ambao una uwezo tutakulipia kama serikali ya Kenya, wewe mwananchi wa kawaida.
Interesting. Now, what's happening to the NGCDF? Well, Game Member of Parliament Elisha Ochieng Odhiambo says that the onslaught on CDF can be diffused through pressure from Kenyans who have in one way or the other benefited from the fund directly or indirectly. Speaking at the Game Wagai Sub-County headquarters during the disbursement of CDF bursary amounting to 31,153,000 to secondary school students, the MP said that parliamentarians will soon meet to work on legislation that will ensure the funds conforms with constitutional requirements. The legislator at the same time called on the Council of Governors to engage the control of budget on the impasse in the county government's bursary funds. Let me take some water.
There was public pressure to terminate NGCDF. But looking at what MPs are doing with NGCDF, it is something that we can never terminate. We can never do what? Because it is NGCDF that is helping parents who are peasants at home who cannot pay their fees. Donge. So I'm calling upon the public. I'm calling upon the public to stand with MPs on issues NGCDF. I read in the papers that the controller of budgets has refused to disburse bursary to county governments. I think county governments are missing the point. There's the governor's council that's supposed to be having quarterly meetings with the control of budgets so that they can negotiate and get bursaries. Because as it is, the only team of leaders helping the public is MPs. The MCAs have disappeared from the public. Maybe they'll come during elections, but the public will not give them opportunity.
All right, let's cross over to Haiti, where the Kenya Police Service team in Haiti has handed over the 3rd Forward Operating Base, or FOB, to the Guatemalan team. The facility, located at the regional office of the Far North for the General Inspectorate of the National Police of Haiti, was previously abandoned following gang attacks in the area. On the 20th of November 2024, the multinational security support established the base at Far North to secure the coastline and surrounding areas. The facility has since undergone extensive renovations sponsored by the International Narcotics and Law Enforcement Affairs.
This facility for the MSS is an important step forward in the restoration of security in the Port-au-Prince area and the wider Haiti, because from here it offers the MSS strategic importance in terms of the ability to project its security.
The workers and the civilians so that they can renovate this building. This building is a very important building in Haiti because it is the headquarters of PNH. So you can equate it to Vigilance House or Jogo House in Kenya. It was taken over by the gangs, and but we supported the Haitian National Police and we reclaimed it.
I'm really proud of our Kenyan troops in Haiti. I mean, they've shown dust to those militias to a point whereby guys in Haiti now know that our boys are no pushovers. Anyway, a family from Shambitsi village in Navajojo, constituency Kakamega County, is calling on the government to exhume the body of their deceased relative or grant them permission to do so. The family wants the body returned to Kakamega County Referral Hospital for a fresh postmortem to determine the cause of his death. Led by Roslyn Hassandi, the widow of the late Hancock Omwaka, aged 34, the family alleged that Omwaka was brutally attacked by over 15 individuals armed with blunt objects at his home. The attack is linked to a dispute over a debt of a cow and loan repayments owed to Omwaka by one of the family of the attack gang. Although an initial autopsy was conducted, the family claims they were denied access to the cause of death.
Alikuwa atishiwa vitisho ambapo alikuwa kwa haki yake. Baba yake Evans Omwiha alichukua pesa zake kitambo pia na ng'ombe. Alipomkula wakati alikuwa anamwitisha kumpatia pesa, hakumpatia. Ikakuwa chuki imeingia. Wakati hiyo chuki iliendelea, ikakuwa tu kila wakati akikuja anatishiwa vitisho. Wakati tumekimbilia serikali haitusaidia chochote. Tumefanya postmortem ya Hancock Mkabana. Tulikuwa na maskari wote wa Navajojo. Na hiyo postmortem results atujui kitu gani iliua Hancock. Tunaomba serikali, mwili ndio hii hapa, kama mnaweza kuja mtoe mwili hapa mpeleke postmortem, tufanyiwe, walete report, tujue nini iliua mzee wangu, at least tufanye nini, turidhike. Inaonyesha tunatishiwa vitisho kuonekana ati sisi wakati tumeenda huko kuchoma, wakati watu walienda kuchoma huko vitu, ati pia hatuna amani. hata paka sasa tunalala kama milango zimefungwa. Alikuwa ameumiza kichwa, uso, kila mahali alikuwa na maalama. Hadi macho alikuwa ametoboa macho moja na vidole alikuwa ameshavunja.
Nataka haki kutoka kwa serikali. Mtoto yangu aliuawa bila evidence ya kuonyesha aliua mtu. Niko na serikali, assistant chief na chief tangu hiyo wakati wachakanyaka hapa. Na wale wenye walifanya hii kisanga ni wasima, wanatembea, wangali, wanatutumia vitisho. Tena vile visanga ilifanyika kwa mapoma yao, tena watarudi hapa, wachome manyumba, tuwawe.
Tunataka mwili wakuje wachukue, kwa sababu hiyo hata wakati tulizika Cox, hakuna kiongozi alikuwa hapa, hata assistant chief, hata...
That's sad. Now, health officials in Kilifi County have launched campaigns to educate residents on assisting snake bite victims get better treatment to prevent deaths. Speaking at the Kilifi County Referral Hospital, the hospital's medical superintendent, Dr. Matano Kibwana, advised residents to always rush victims to the nearest medical facilities before the snake venom gets severe. The calls comes days after a 14-year-old boy from Palakumi village in Ganze sub-county was bitten by a snake, but those around him delayed to rush him to hospital, hence occasioning a swollen leg. Harrison Kahindi was herding his family cattle together with his elder brother when the attack happened. The boy is in good condition and responding well to treatment. Calls have been made for residents, especially in snake-prone areas, to be sensitized to how best to handle victims of snake bites to minimize catastrophes.
Kachunga ng'ombe, kashukua kanyuma nyoka, kabeba na gari kazi ya Ganze, la Ganze makilola shika za kuku gaino Kilifi.
Nimetoka Ganze ukandikiwa Kilifi na mtoto wangu amepata hasara kuumwa ni nyoka. Unafika huku Kilifi hukaenda kama kumtibu kitoto kisawasawa.
What had happened is this is a case that happened at around 12 midday. He was taken to a peripheral facility, and at the peripheral facility they were not able to manage him, so he was referred to us. So the patient arrived at our doors at around 1940. Normally we have an EMR system, so we are able to pick at what time he exactly arrived. He arrived at 9660, and as per the audit trail of the EMR system, and already management had been done by 8 or 9, so there was no delay. First, there was a delay between when the snake bite actually happened and them getting to the peripheral facility and being told that they couldn't be cared for there, so they were sent to the bigger facility, which is us. Normally what had happened is immediately someone is bitten, and he was bitten at the toe area. Already by the time he came here, the edema or the swelling of the limb in normal terms had already gone up to somewhere just above the knee. So it means that the effects of the venom had already taken place.
Now, I know the scripture says a good man, a righteous man takes care of his animals. But if there is an animal that I hate, snakes, whether it's a real snake, live snake, dead snake, a plastic snake, or anything snakish, I just hate snakes. I can't stand them. And I'm glad Nairobi is not that much of a snake-prone area. Because, hey, wacha to take a break and then tukirudi tukujie mangaseti. All right, welcome back. Let's take a look at the newspapers. Today, the nation feels... I think Alan ametoa page huku ndani. Unajua Alan, we have a guy called Alan here. He loves cutting pictures za gazeti. Unakumbuka vile tulikuwa tukata picha za gazeti tukiwa young. The nation today feels very light. A Daily Nation, the headlines, killed in 21 days. These are girls, ladies that have been murdered in the last 21 days. Did you see that story of that guy who was arrested in Huruma carrying the body parts of his wife? I mean, and the guy just looks, he doesn't look troubled. I mean, he just looks like it's something he's done for, it's not the first time. He's done it before, and he's just okay with it. I mean, I was troubled. I couldn't believe it. And we have the pictures of some of the ladies that have lost their lives. There's Jane Wanjiro, there's Lydia Tokasi, there's Aisha Abubakar. Then we have Winnie Kushusha, Beth Modhoni, Marianne Kilonzi, Ashley Wairimo, and Precious Nderema. These are some of the ladies that have been killed in the last 21 days. It's really unfortunate. Our 34-member task force has actually been formed to combat the rising cases across the country. What is leading to this? That's what they need to find out. And then there's some 4 guys have been jailed for 135 years for killing 4 grandmothers. I think this should be in Kisii, because what happens is, if they suspect that you're omulosi, you've been doing witchcraft, they come and take you and burn you. But some of the times they kill these old women because they want their land. They think this woman has lived too long. So we need to get them out of the picture so that we can possess their land. Now we also have 2 politicians among 5 to be quizzed over Molo activist murder. And then we also, on page 3, no party as Lake Nakuru turned into a conflict zone and a death trap. Then femicide crisis, alarm as 15 women killed in 3 weeks. And then we have the picture of the dude who was walking in Huruma with the body parts of his wife. He's going to be detained over that. Kenyan bank executive murdered in London. Then the back page of the Nation, we have supply of vital vaccines restored. This is according to the Director General of Health, Patrick Amoth. Then we got the Standard, and it's got a face-off. And this face-off is between Ruto and JB Muturi. And it says Public Service Cabinet Secretary Justin Muturi skipped Tuesday's meeting with his handler, saying he wasn't properly invited. However, Secretary to the Cabinet is having none of that, saying he absconded the session, an indication of deep cracks in the Kenya Kwanza government. Then Gashagua's fate, political fate rather, lies in the hands of judges. Then Ruto's big gamble on state cooperation. And then the third page, I think this situation in Lake Nakuru is troubling. A trail of deaths, kidnapping as conflict in Lake Nakuru intensifies. Then on the third page, you got DCI probes man with mutilated wife's body parts in Huruma Estate. These guys need to be investigated. I would have said how the investigation should be carried out, but I wouldn't, so that they can reveal whether there is a body parts cartel that is going on in the country, as we see quite a number of people disappearing. And page 5, you got what Ruto's bold state corporation overhaul means for civil servants. Education sector braces for job cuts, closure in proposed mergers. And then we have how parastatal mergers and shutdowns hit hard big name appointments. Then the back page of the Standard, you got this must be a Manchester United guy holding his head. This is Manchester United's midfielder Alejandro Garancho, after he missed chances. Worst ever, Manchester United turned to Europa as saving grace. Then the Star newspaper. Ruto bill to unleash EACC on graft lords. The bill allows home search without court order, corruption cases to be concluded in 6 months. And then, so you have Joshua Kutuni is the one who's in charge of the Kenya Copyright Board. Then you have Rashid Echesa, Kenya Water Towers Agency. Then you have John Mrutu, he's AFC. Then you have Evans Kidero, KNTC, 84 CEOs and political bigwigs stare at job losses in new reforms as the state corporations basically with the president saying that he's going to end their life coming to pass. City man found with wife's thorax, detained for 21 days. Kiambu hires 77 nurses. Turning point, Ruto team to enact radical anti-graft laws. And then the back page of the Star, police go to the top. This is football. This is football. It's not corruption report. We've been talking about corruption, but every now and then police is always at the top. So this time it's good that they've gone on the top of at least something else, right? Anyway, with that, we got to bring down the curtains on the show. Do have yourself a lovely morning. Remember, at 9, we're going to have Your Faith today with Reverend Kavoy. Great music is going to be there, administration of the word, so you don't want to miss that. And then Manukato is going to come in at 2 p.m. With Teddy and DJ show. So stick around. Got some great stuff coming.